I'm Mabel Jong. You're watching HD Live, the streaming video service of Health Day News. The coronavirus pandemic has put a spotlight on mental health. How has the pandemic been affecting our mental health? Are there keys to getting more resilient to see people through this crisis? Joining me now is Dr. Dawn Mordecai, National Mental Health and Wellness Lead at Kaiser Permanente. Dr. Mordecai, it's so great to see you. Thanks for joining us.
Hey, good afternoon, Mabel.
Well, tell me, how would you characterize how people are doing right now during the pandemic? How are they feeling overall?
Yeah, well, I mean, what you see is really a whole variety of responses, largely based on how people are experiencing the pandemic itself. It's almost the same as, the varying ways people get physically ill with the pandemic is reflected in the sort of mental health responses that people have. So, people who have gotten ill themselves, have had loved ones who've gotten ill, maybe are frontline workers, things like that. They're much more at risk for dealing with more serious mental health effects. But all of us are affected, right? If I told you, 3 months ago that any one of these things was going to happen, like, oh, your kids won't be able to go to school, you don't get to leave your house except maybe to shop, you're worried about your job, you're worried about your health, you're worried about your loved one's health, and you have those concerns for everybody in your life, any one of those things would be tremendously stressful. So, what we see is this whole range of people who are appropriately worried, concerned, all the way to people who may have things like post-traumatic stress disorder from being on the front lines in healthcare settings.
Mm-hmm. And do you see that people have a long-lasting effect from this, even when we see better days after this pandemic? Will they be affected long-term?
Yeah, it's a good question, and the answer is not necessarily. When we look at studies of past natural disasters, pandemics, things like that, most people do okay, which I think gives me some reason for optimism. But there will be some people who have long-term effects, and again, it's people who've been profoundly affected by the pandemic, perhaps people who had pre-existing conditions that got worse. It's important, Mabel, to realize that this is coming on top of an already existing mental health crisis in our country, which has been, somewhat recognized, but I think under-recognized. When we think about rates of depression, rates of anxiety going up, rates of suicide increasing, the so-called deaths of despair from suicide, overdose, alcoholism, all of those things have been going up for decades, really. And now you bring the pandemic in. So it's not like we were in good shape in terms of our mental health and now it's getting worse. It's more like we were not in good shape and you bring in another big stressor.
Sure. Now, how can doctors help patients during this time? And what should loved ones and caregivers be on alert for that may signal a need for extra support?
Yeah, I like that question a lot. It points to one of the most important things that I think people can do in general for their mental health. And I call it maintain or strengthen social bonds while you maintain physical distance. So, this social distancing was sort of unfortunately named, I think, because really what we want people to do is to maintain social connections, because those are so important to mental health overall. When you're specifically concerned about somebody that you love, then probably the best thing you can do is check in with them and express concern for them. And if you find that they are really not doing well, not functioning well, maybe that they have a pre-existing anxiety condition or depression condition, make sure that they are taking steps to take care of themselves. See if there's something you can do to assist them. If they're already in treatment, are they following their treatment plan?
Mm-hmm.
Are they doing sort of those basic things that we should all be doing, like eating right, getting enough rest, exercising, all those kinds of things? Because the greatest risk is people get socially isolated, they drop their routines around maintaining their mental health, their physical health, and that's really a setup for people.
Okay, now I like what you were saying, that really check in with people to make sure that they're taking care of themselves. I mean, Are there other things that people can do to build resilience, to really get stronger, to help see themselves through the isolation? Perhaps being alone all day doesn't work for everyone.
No, it certainly doesn't work for everyone, and that's why that sort of checking in with others can be crucial. I think there are absolutely ways that people can build skills, build resilience. I'll go back to exercise because it's actually one of the most studied things that we can do to support our mental health, our brain health, and our physical health. That's not easily done necessarily for everybody, but I think there are ways to safely bring that into your life. Things like mindfulness, meditation, yoga. A lot of people are sort of exploring these other ways around, how do I help myself stay calm, stay healthy, things like that. Keeping a positive outlook, not spending too much time on the media, because there is just, it's 24/7, COVID, fear, surge, all these things. And it's important to stay, up to date, but that doesn't require hours and hours a day. So, if the TV's on in the background, maybe turn it off, because it's a constant message that's anxiety provoking.
Yeah, and what about those folks that can't turn it off? The frontline workers, for instance, so the healthcare workers who are face to face with this crisis head on every day. What is your advice for them?
Yeah, when we're talking about people who are, especially in the healthcare space, emergency medical responders, things like that, that's a group where there is real risk for post-traumatic stress disorder, depression, anxiety disorders, substance use disorders. I mean, we're all at risk of those things always in society, but now for frontline workers, it's particularly risky. I think in their case, leaning on the supports around them, taking care of each other, looking to their teammates, checking in on their teammates. Sometimes the best way to take care of ourselves is to look after other people. Take advantage of the resources that their companies are bringing to them. So we at Kaiser Permanente have put a number of resources, made those available for our frontline staff and really all of our staff. But really wanting to emphasize, like, you need to take care of yourself. You need to pay attention to your mental health, look after your colleagues. And then, of course, there's all the basic staying safe in terms of the job that you're actually doing to take care of patients, things like that.
Well, mental health has been a cause that that Kaiser has been championing for years. How has this situation hastened your efforts at Kaiser? And also talk a little bit about the apps and the partnerships that you've put in place at Kaiser, My Strength and Calm.
Sure. So yeah, this has been an emphasis for us for a long time. We think of total health as both physical, mental, and increasingly social health, which you hear about social determinants of health more and more, and that's something that we're really bringing to the fore. We did the original adverse childhood experiences study over 20 years ago now, and if you're familiar with that study, it demonstrated that adverse events that happened to you as a child seem to be linked to negative mental and physical health effects much later in life. And so for us, really seeing this whole life picture and trying to move upstream in that process, like, how can we affect those adverse events? Can we decrease the effect? Can we minimize the adverse events themselves, and then reap the benefits for people much later in life in terms of physical and mental health? That's a big emphasis for us. Even before COVID, we had come out with something called Find Your Words. It's still out there at findyourwords.org, and people can go there. You had mentioned, what if you're concerned about somebody in your life? It's a great place to get resources to think about, well, how do I talk to somebody if I'm worried about them? Should I be worried about myself? Reading up on depression, anxiety, things like that. It's in English and Spanish, and we've just put it out to the world. Anybody can access it. And then you asked about, what's been going on more recently. Well, we had been working for a few years to bring so-called digital therapeutics into our sort of toolbox for mental health. And so these are very high quality apps. People probably recognize Calm or My Strength. And we've made those available at no cost to our members because we felt like they were really good products, good ways for people to learn mindfulness, calming, to encourage good rest and sleep. And we've had tremendous uptake on those. We were able to bring them live just as this was really starting to hit. And so the timing couldn't have been better for our members. And we're happy to have them out there. And then we're also doing something novel recently. We've become the first healthcare organization to partner with an esports team. The team is called Cloud9. And the interest here was, can we work with a very popular esports team in the gaming space where so many young people are spending a lot of time to bring health messages, to bring mental health messages, to bring anti-stigma messages. So we're very excited about that. That's just gotten underway.
Okay. Do you think, Dr. Mordecai, that this has changed the mental health landscape in terms of how companies approach this and benefits they may offer to employees to ensure that their employees are healthy mentally? And what about paying for this kind of health care, the delivery of this? How is that going to change after the pandemic is over?
Yeah, I think there's been some profound changes. I mean, the most obvious one is that almost all of mental health and addiction care went online in March. We were fortunately really well positioned with that. We've been doing online care for a long time, but we saw it go from, I don't know, 20% of our visits up to well over 90% of our visits. And that's a profound change that I can't imagine another thing that would have generated that kind of change that quickly. It remains to be seen what the sweet spot is for our members and patients. What do they want? How often do they want to come in versus really loving being able to do their appointment on their phone, which is what a lot of people are doing now. And I don't know the answer to that, but I suspect we're going to be doing a lot more of care in this way than we were before. Now that assumes to a certain extent that the federal government continues to make it possible in terms of payment for that kind of care. They had to change some of the rules, particularly around the way Medicare and Medicaid pays for care, to allow for video appointments, phone appointments, things like that. I'm hopeful that they'll also see the light and say, well, this seems to be what people want to do, and make those kind of changes permanent, because we think these are important ways to bring care closer to people.
Yeah.
And I do think companies they have been and are becoming even more aware of the importance of mental health for their employees, that it's good for the employees, it's good for the companies in terms of productivity and their bottom lines. So you are seeing more emphasis on making these resources available to employees. We're doing work internally to decrease stigma around mental health among our own employees, having sort of mental health ambassador programs and trainings, and I hope to see a lot more of that throughout the industry.
Well, it sounds like you're encouraged that people are doing relatively well given the circumstances, but the longer this goes on, are you concerned that you're going to see what people have been predicting, that we're going to see a mental health crisis? Give me your thoughts on that.
Yeah, that is a big unknown still, right? We have hints, we have surveys from people like the Kaiser Family Foundation saying that half of people are saying the pandemic has had an impact on their mental health. We see surveys where people describe increased symptoms of anxiety, depression, things like that. That's different from a full-blown mental health disorder. And I think it remains to be seen how it translates long term. I personally think we will see some kind of increase. It may not be as big as people think, or it may be, and that depends on where we go from here, right? Does it come back? Do we have to lock down again? Things like that can have a pretty profound impact on that. Long term, I'm hopeful that, people are resilient. People tend to bounce back. We bounced back from the pandemic in 1918, 1920, and our society now is a product of that. And we've done amazing things, and we're fully open and, traveling and all those things. But, I think we have to stay watchful. And I do want to emphasize again that we were not in a particularly good place before this pandemic. So I don't expect, we're going to be facing those issues again, even if this clears off and doesn't have a long-term profound impact. We still have to address the fact that 1 in 5 people have a mental health condition and less than half of them get any treatment at all. And that's just wrong. These are treatable conditions. There should be hope that people can get better, and yet, we're not taking care of our countrymen and women the way we should.
Yeah, and I did want to ask, since we're talking about polls and surveys, earlier this month, people responded that they were the unhappiest they've been in 50 years. Do you see people returning to a post-pandemic level of well-being, and how?
I do over time. I don't know how long it's going to take. Those polls are being taken right in the midst of it, right? This is still kind of new for us. But like I said, people do tend to be resilient, and I hold out hope for that. I certainly hope we can move back into a society that does not have as much stigma about mental health. I think one of the silver linings here may be that so many of us have had to deal with symptoms of anxiety, the concerns about isolation, and those are things that people with mental health conditions have known for a long time. But if the rest of us essentially get a taste of it, does that allow us all to talk more openly about it? And I hope so. But long term, I think we're going to be okay.
All right. Dr. Don Mordecai, National Mental Health and Wellness Lead at Kaiser Permanente. Thank you.
Thank you, Mabel. Great to talk to you.
Thank you so much. And thank you for watching HD Live, the streaming video service for Health Day News. For more news, remember to check us out at live.healthday.com. I'm Mabel Jong. Have a safe and healthy weekend.